I had a mom come in and said she just wanted to tell me about a couple of issues. She said, I couldn't believe the first night when my child didn't snore. The child came up and said, Mom, what's that noise? And he pointed to the refrigerator because he'd never heard the refrigerator run. The practice was started in 1988. I had graduated from residency the year before and spent a year working in Georgia. Noticed a great opportunity here and started a solo practice.
I actually had been in practice in Indianapolis for almost 15 years. Had always been in a big group in a big city and thought it would be maybe nice to join a smaller practice.
I left the big group for a lot of the same reasons. I was just having trouble getting started in a big group like that. And so I went the other way. I went to a tiny solo practice in Walterboro. Tim reached out to me and let me know that there might be room here, and we visited here and loved it.
Typical day starts around 6:30 or 7 o'clock, and very often is surgery in the morning because we do a lot of surgery on kids, and kids can't eat or drink after midnight, and you don't want them going until 1 o'clock in the afternoon without any food in their stomach.
We do have a combined experience in 60 years, and it's a unique situation. We also work together, which is unique. When you have this much experience, if you have a problem in the office, you've got two other people to ask, and it's real simple.
And we see everything from infants to people in their last decades, and it's nice to have a variety.
I think the biggest challenge in medicine, though, is how to deliver care to people professionally, adequately, and also personally with all the changes that are occurring in insurances and national health care issues.
For a small practice, we have pretty state-of-the-art equipment. Microscopes for looking at the ears and telescopes for looking into sinuses. So I think we're able to offer those services, which is unique for a small practice. It's nice to be with Dr. Parsons and Kelly because they have, a more experience than I do, and they're a great fund of knowledge for the way it's always worked. And I think I'm the one that's kind of always pushing the envelope on the technology, and I hope that they're able to pick up, some of that just like I picked up from their experience.
Well, I think this is a unique practice because we offer services from children who are 3 days old to patients that are 98 years old, such as the one I saw the other day who was having a hearing problem.
I think the nice thing is that with our experience, we really can take care of pretty much everything that walks in the door.
Well, I think one of the best things that's happened with both Dr. Jones and Dr. Kelly is they have a unique ability to take care of children. They enjoy it, they're very good at it, and they're very good with the parents.
I learn every day from my patients, I learn from my journals, I learn from my partners, and I really enjoyed that. The range of patients we have. I love taking care of kids, I like to take care of adults. It's really a neat field in that regard.
Well, one of my patients who had a cancer in their tonsil, which we treated with a variety of therapies, including surgery, came to see me and just said thank you for allowing me to see my granddaughter grow up, because he's 65 years old, and he genuinely meant that.
I can think of one particular patient. I'd been here maybe 6 months, and a woman had what's called a tracheocutaneous fistula since childhood. She had a tracheotomy, which is a hole in her neck for an airway as a child because of a congenital problem, and she had never had it fixed, so she couldn't really take a bath, she couldn't lay down in a tub, she couldn't swim, she was afraid to go on a boat because the water would go in there and she could drown, and she had seen somebody else and they said that they couldn't do it for some reason, and we were able to take care of that. And I remember her coming back because she had gone swimming and she just started crying. She was just so happy.